Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Squamous epithelial cells. What to know? Squamous epithelial cells are a type of flat cell found throughout the body, including in the mouth, on the lips, and the cervix. They are also seen in the middle layers of the skin. /r/n/r/n squamous cell carcinoma is a form of cancer affecting the epithelium's squamous layers. It's the most common cancer of the oral cavity and also is common in the cervix and the skin. /r/n/r/n This article discusses squamous epithelial cells and conditions that may affect them. It also explains what it means to have abnormal or atypical squamous cells found on a pap smear or other tests. /r/n/r/n Squamous cells often are involved in abnormal pap smears. A diagnosis of atypical squamous cells of undetermined significance, ASC-US, indicates the presence of unusual cells that are not clearly benign or bad. /r/n/r/n Abnormal pap smear results are sometimes diagnosed as squamous intraepithelial lesions. This is a very specific diagnosis of an abnormal pap smear considered precancerous. /r/n/r/n When you receive this diagnosis, it means that the squamous epithelial cells found in the cervix have taken on an abnormal morphology, or shape, but aren't necessarily cancerous. In fact, low-grade squamous intraepithelial lesions, LSIL, often heal themselves without intervention. /r/n/r/n These lesions are also sometimes known as cervical dysplasiasor, cervical intraepithelial neoplasia, CIN, high-grade squamous epithelial lesions, HSIL, are more likely to become cervical cancer than LSIL. However, they can also regress. /r/n/r/n There are several other pap smear diagnoses. These include ASC-H, atypical squamous cells, cannot exclude HSIL. As with ASC-US, the meaning of ASC-H is unclear. However, cells diagnosed as ASC-H are more likely to be problematic than those diagnosed as ASC-US. /r/n/r/n There is also a pap smear diagnosis of atypical glandular cells, AGC. This diagnosis refers to changes in the glandular cells in the cervix, which are not part of the squamous epithelium. Changes in the glandular cells generally require more intensive treatment than changes in squamous cells. /r/n/r/n Most cervical cancers and precancers are caused by infections with human papillomavirus, HPV. HPV infects and transforms the squamous cells of the cervix. It can also infect and transform the cells of other tissues in the body. /r/n/r/n HPV is transmitted through skin-to-skin contact, including oral, anal, and vaginal sex. /r/n/r/n Screening guidelines from the U.S. Preventive Services Task Force recommend a pap smear with HPV go testing for women aged 30+ every 3 to 5 years and a pap smear only for women aged 21 to 29. /r/n/r/n Depending on circumstances, over time, healthy cells may replace these transformed cells or they may continue growing abnormally and become cancerous. /r/n/r/n Most cervical HPV infections do not lead to cervical cancer as the body is often capable of eliminating these infections on its own. /r/n/r/n HPV infection is also associated with squamous cell cancers in other locations. They include cancers of the head and neck, the vulva, the penis, and the anus. In fact, some scientists estimate that 4 out of every 5 cancers are caused by HPV. /r/n/r/n Fortunately, HPV-associated cancers have been found to be more treatable than other squamous cell cancers, at least in the head and neck. /r/n/r/n The risk of HPV infection can also be reduced by vaccination. Cervarix and Gardasil are 2 vaccines that have been shown to reduce the risk of HPV infection. However, they are most effective when they are given before young people become sexually active. /r/n/r/n if you are a young adult or the parent of a young adult, talk to your healthcare provider about whether the HPV vaccine is a good option. The HPV vaccine is currently recommended as a routine vaccination for young men and women between the ages of 11 and 12. It can be given up until age 26, depending on the circumstances. /r/n/r/n The U.S. Centers for Disease Control and Prevention and the ACS recommend HPV vaccination begin between ages 11 and 12 and 9 and 12, respectively. Though the vaccine is approved for people 9 through 45, it's most effective when administered early. People over 26 generally do not benefit from the vaccine as they're likely to have been infected by HPV by that point. /r/n/r/n The ACS recommends against HPV vaccination for most people older than 27 due to low effectiveness at an older age and a vaccine shortage. However, the American College of Obstetricians and Gynecologists, ACOG, says unvaccinated women aged 27 to 45 can discuss whether to get the vaccine with their healthcare provider. /r/n/r/n Treating abnormal squamous epithelial cells depends on the specific diagnosis. Low-grade squamous intraepithelial lesions, LSILs, found in a pap smear may normalize on their own. However, a closer follow-up with more frequent testing may be necessary. /r/n/r/n But when abnormal epithelial cells appear to have a risk of being concerning or cancerous, treatment involves excising or removing the abnormal tissue. /r/n/r/n A common excisional method is known as a loop electrosurgical excision procedure, LEEP, where abnormal cells are cut away by a wire loop that's heated with an electric current. A cone biopsy is another common way to diagnose or treat these abnormal cells. /r/n/r/n A urinalysis is a standard test that analyzes the substances in your urine. This includes the amount of epithelial cells your urine contains. /r/n/r/n While it's normal to have small amounts of epithelial cells in your urine, large amounts may signify something is wrong, such as a contaminated specimen, an infection, or another medical condition. /r/n/r/n A urine sample is needed for an epithelial cells in urine test. You will receive a container where the urine is collected and given instructions on how to take the sample to ensure it does not get contaminated. /r/n/r/n Typically, you will not need to fast or do other preparations before taking the test unless instructed by your healthcare provider. /r/n/r/n Results of cell amounts are usually reported as approximates, such as few, moderate, or many cells. Few cells mean that your epithelial cell numbers are considered to be in the normal range, while moderate or many cells may be a sign of a medical condition like /r/n/r/n Know that having results in the abnormal range doesn't always mean you have a medical condition. Your healthcare provider will typically order more tests to form a final diagnosis. /r/n/r/n Squamous epithelial cells are found in the skin, mucous membranes, and tissues lining your organs. Abnormal squamous epithelial cells are often detected on pap smears and are associated with HPV-related cancers. /r/n/r/n Squamous epithelial cells found on a urine test can indicate a UTI, liver disease, or cancer of the urinary tract. They may also indicate, however, that the test was contaminated and needs to be repeated. /r/n/r/n Receiving abnormal pap smear results can be upsetting. However, oftentimes, these cervical cell changes diagnosed as ASC-US or precancerous lesions clear up on their own within a year or two. /r/n/r/n If you have an abnormal urine test or pap smear, your healthcare provider will discuss your options for further testing and treatment. Often, a wait-and-see approach, along with more frequent monitoring, is the recommended course of action. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.